Well, June is Post-Traumatic Stress Disorder Awareness Month, a condition people can develop after experiencing or witnessing a life-threatening event. The goal is to spread the word that effective treatments are available. Dr. MacKenna with Dara Wellness joins us now to detail the symptoms and kind of what PTSD is.
Yes. So PTSD is when we've been exposed to some type of trauma. Now, people who are exposed to trauma have what we call the fight or flight response.
Sure.
Heart rate goes up, blood pressure goes up, sugar increases in our blood to help our muscles run or to fight. We can also have the freeze response. That is also something that happens with trauma, where people just literally freeze and their brain kind of shuts down and they're unable to function. In PTSD, those symptoms extend beyond the period of trauma. And beyond really the weeks after. We can have kind of an initial acute stress response that resolves within a few weeks, but PTSD is something that occurs for over a month and really extends those symptoms by many fold, and to the point that it's interfering with our life and our ability to function.
What would be an example? I think a lot of people think of military service, but you were saying just a minute ago that women actually are some of the most affected by this.
Yeah, so about 6 out of 100 folks who are exposed to a trauma will develop PTSD, and women are 2.5 times more likely than men to develop post-traumatic stress disorder. There are different symptoms and factors that make people more likely to develop PTSD. That could be having past traumas in childhood, or a family history of trauma, or just a history of mental health illness.
Sure.
But things such as Katrina, we just had these storms last night. That could be very triggering for folks who maybe experienced that trauma and have some PTSD lingering over that. Any type of, here in the Gulf Coast, I think that's, weather is a big factor, which you're familiar with yourself. Yeah. But also, actual having crimes committed towards you or domestic violence. And then, of course, we all are probably more familiar with what happens with our military and the exposure that happens in combat.
Sure. And then, one of the whole reasons for this month being PTSD Awareness Month is to let people know who may be going through this what it is so that they can put a name to it, but also that there are effective treatments out there. What are some of those treatments? Is it stuff you can do at home or you need to seek help?
Well, when you initially have a trauma, it is important to talk to someone. One of the main symptoms of PTSD is avoidance. And avoidance is unfortunately a factor that goes from the trauma and that trauma experience to the post-traumatic stress disorder kind of taking hold. So a lot of the therapies are going to be about exposure. Other symptoms that occur are things like nightmares and a reoccurrence of the event, whether it be through flashbacks or things happening in sleep or just during the daytime, and avoidance of those things that kind of trigger you. So the therapies help with that.
If you're having nightmares about, a previous trauma, it's so hard to control your brain. It's impossible, really,
right,
in the overnight. So how do you work through that with people?
So there actually are therapies for like image rehearsal therapy. There's specific therapies for nightmares that help you kind of take control of the narrative while you're sleeping. And that's actually a very time-limited therapy that folks maybe are not as familiar with. There's also medications and supplements. I'm at both integrative medicine and psychiatry, so I will, depending on the person, offer different medications, or there are supplements that help with nightmares and things that maybe are a little less harsh, because I'll see folks with things like traumatic brain injury, which is another type of trauma, has the PTSD symptoms, but maybe don't respond the same way to medications.
So if you're unsure, if you're having some of those symptoms, but you're unsure, seeking a mental health professional is definitely a way to get more answers and some help.
Absolutely. It's important to talk to someone, to get that support from loved ones, from family, but also, like you said, talking to a therapist, even just to be evaluated, can really just be a form of therapy in itself, just getting it out of you and talking about it. I've seen in like our World War II veterans, our Korean War veterans, symptoms of PTSD that are similar to those of more recent combats. And that's because they didn't have that opportunity to talk about it and to process it and to get through it. And so now we have those therapies available. So reaching out is super important.
And it's never too late. Thank you, Dr. MacKenna, for joining us this morning.
Absolutely.
I appreciate it.